Welcome to ASHA's Sex Plus Health podcast. I'm Martha Kempner. January is Cervical Health Awareness Month. With HPV vaccination and regular screening, we have the tools we need to eliminate cervical cancer. Now we have a new tool, HPV screening with self-collected samples. We invited Dr. Rebecca Perkins from Tufts University Medical School to talk about this new screening tool and its potential to help more women screen and prevent cervical cancer. Dr. Perkins, thank you so much for being here. Can we start with you just introducing yourself and telling us what work you've done in HPV? And also, can you explain the Enduring Guidelines Committee to us?
Sure. So my name is Rebecca Perkins. I'm a professor of obstetrics and gynecology at Tufts Medical Center. I've been working in HPV for a couple of decades now. It is a wonderful place to do research because there's so much happening in prevention of cervical cancer and other HPV-related cancers. Between 2017 and 2019, a national consensus of 19 organizations got together to make new updated guidelines for the management of abnormal PAP and HPV tests. It's managed by risk, not exactly by test results. So if someone has a risk of 1 in 1,000 of developing precancer over the next 5 years, then we say you are safe to come back in 5 years. On the other hand, if their risk is more than 4 in 100, we say you need to come in right now and get a biopsy to see what's going on. So then when you have new tests coming out, you can apply those tests to the risk framework. We make new guidelines for new technologies like extended HPV genotyping. So when you actually know what type of HPV it is, how do you manage that differently? And then what we'll be talking about most of today is how do you use self-collected HPV tests for screening.
Before we get to self-collection, there's still some confusion about the difference between PAP tests and HPV tests in general, and they are both important parts of cervical cancer screening. Can you just explain the difference kind of briefly?
Yes. So for many, many years, since about the 1950s, we have had the PAP test. It's called the PAP test because it was invented by Dr. George Papanicolaou. And so it's named after him. And what he found was that if you take a sample of cervical cells and look at them under the microscope, you can find changes that mean a patient has a precancer, which allows you to treat that before they develop an invasive cancer. So the way the pap smear is done is the healthcare provider will put in a speculum, make sure they can see the cervix, which is the neck or bottom part of the uterus. They'll use a brush or other device to gently remove a small number of the cells, and then those will be sent to a lab to be analyzed. And so the pap smear is like a photograph. So it tells you what's happening in the cervix today. But then in the 1980s and 90s, we started to understand that essentially all 99.7% of cervical cancers are caused by infection with carcinogenic or cancer-causing types of human papillomavirus or HPV. So once we knew that HPV caused cervical cancer, then people started to develop tests for HPV. And then we found that when someone has HPV, that doesn't mean that they have cervical cancer today, but if they keep having HPV for 5 years, 7 years, 10 years, with every passing year that infection doesn't go away, it's more likely that they'll develop a precancer or a cancer. So if someone has a positive HPV test, it's like a crystal ball because it doesn't necessarily tell you if someone has a precancer today, but it says they're at risk today and into the future. The HPV test, because it has that futuristic characteristic to it, it's a better screening test than the pap smear because if something is wrong, it picks it up 95% of the time.
It picks up something that might be wrong in the future, not necessarily just what's going on right now.
Both. So it picks up something if something's going on right now, it picks it up 95% of the time, and it gives you information about what might happen in the future. The pap test picks up what's happening right now about 70 to 80% of the time and doesn't give you that as much reassurance into the future. And that's why we need to repeat the pap smear more often because every time we do it, we miss some stuff. So we need to do it more often, whereas the HPV test we can do less often because it picks up more things the first time around.
So, who's supposed to get which test and how often are they supposed to get them? I know it's not an easy question to answer.
Well, it should be, except that not everyone agrees on the answer to it.
Okay.
So I'm going to start with the answer that everybody agrees on. Everybody agrees that people between the ages of 30 and 65 should be screened with an HPV test, either alone or with a pap test. Between the ages of 21 and 29, there is not agreement because of various things. So there's sort of two main organizations in the United States that make cervical cancer screening guidelines. One is the American Cancer Society, and the other is the United States Preventive Services Task Force. The most recent guidelines are from the American Cancer Society, with the comprehensive set of screening guidelines that came out in 2020 and an update that came out in December of 2025. And the American Cancer Society recommends screening with HPV testing starting at the age of 25. The U.S. Preventive Services Task Force has not had new guidelines since 2018, and they are in the process of revising those guidelines, but we don't have final guidelines from them yet. The older guidelines recommended screening with a pap test only between the ages of 21 and 29. And the difference is mostly because a lot of people between the ages of 21 and 29 have an HPV infection, and many of those will go away without causing cervical precancer. And so you will find a lot more positives between the ages of 21 and 29 than you will between the ages of 30 and 65. And for each positive result, you're a little bit less likely to find precancer. And that's why American Cancer Society has sort of split the difference by starting at 25, because you don't really want to do an HPV test, and they're not even FDA approved for anyone under the age of 25. But on the other hand, the age group with the highest risk of a precancer is 25 to 29. So you don't really want to miss them either.
But so the American Cancer Society says to do HPV tests and not do a pap test. You would only do a pap test if the HPV test came back positive.
Exactly. So the HPV test is very good at telling you something might be there, but it doesn't tell you if it's actually there or not. So that's where you want the pap test, or in some places you can do a dual stain test where you look at the cells, the laboratory pathologist looks at the cells under the microscope to see if they're abnormal, and then that can direct the clinician to say whether or not the patient needs to come back for a colposcopy with biopsy procedure.
Okay, I'm just going to ask you to tell us what a colposcopy is, and then we will move on to self-collection.
Sure. So you can't prevent cervical cancer without looking at the cervix, figuring out if there's precancer, and treating it if it's there. So screening is the critical first step because half of cancers occur in people who have not gotten screened, but another third of cancers occur in people who got screened, the screening test was abnormal, and then they never followed up. So it's really, really important to follow up after an abnormal screening test, whether that's a pap test, an HPV test, both of them together, whatever it is. If it's abnormal and your healthcare provider says you need to follow up, please follow up because it's really important to prevent cancer. What the follow-up entails is something called a colposcopy. That is usually done by a gynecologist or sometimes a different kind of doctor or provider who has had special training in performing colposcopy. And basically, it's what you would feel as a patient is sort of like a pap smear exam, but it lasts a little bit longer because what the provider will be doing will be putting in the speculum, looking at the cervix, cleaning the cervix with a special material. It's actually a dilute vinegar solution that allows us to see abnormal areas because they will turn a sort of whitish color temporarily. It fades over about a minute or two. And then we'll look with a machine called a colposcope, which is a machine that doesn't actually touch the patient's body at all, but it has light and magnification and allows us to see what's going on better. And then if we see anything that could possibly be a precancer or something that might need treatment, we would take a very tiny, teeny tiny, less than 1 millimeter piece of skin called a biopsy and send that to the lab for analysis to see if the patient needs treatment.
Thank you. So going back to screening, we've recently added self-collected screening tests. And can you explain what those are and where we would do them?
Yes. So over the past year, several tests have gotten FDA approval for self-collection done for the most part right now in a healthcare provider's office. And there's one combination that can be done at home, and others are going for home approval. So that may happen. That may happen soon. It's very important. So the FDA approval process is very important. It's important that if you are doing a self-collected HPV test, that you're getting it from your doctor or healthcare provider, because not all of them have been tested very rigorously. And if you are using a test, you want to make sure that it's giving you an accurate result. So the steps would be you talk to your doctor or go to your doctor or healthcare provider's office. They will give you a little kit, which is some sort of a collection device like a long Q-tip or a brush. In the bathroom, you would insert that gently into the vagina, rotate it for 30 seconds, take it out, put it in whatever tube or thing they gave to you, hand it off to the medical assistant or laboratory person, or if it's a home test, put it back in the kit in the mail. And then you will get a result back saying whether it's HPV positive or HPV negative.
So just with the giant Q-tip again, do you have to reach your cervix with that?
You do not. So the reason it's so important to have the right test is because the tests that work for self-collection use some sort of PCR or equivalent DNA amplification technique. There are always sort of skin cells in the vagina that you can pick up and test for HPV. And there might only be a teeny bit of HPV that you get from that vaginal sample. But if you're using the right test, the test is going to find it, because as they're doing the analysis, they'll sort of make copies of any HPV DNA that's there. And so if there's anything at all, they're going to find it. If it's another kind of test, they might miss it. The studies have shown that it really depends what kind of test it is, whether it works or not.
So who would want to do this? Who might want to do this instead of letting their doctor collect the sample, given that you're probably either going to your doctor's office or you at least have to get in touch with your doctor in order to do this?
People who might want to do this is maybe they can get in touch with their primary care doctor, but the primary care doctor either doesn't do cervical cancer screening, they try to send them off to a gynecologist, or maybe they saw their primary care doctor, had a lot of other concerns, couldn't get to the speculum exam that day, and this would be a way to do screening. Or patients who are just very uncomfortable with a pelvic exam and would prefer to avoid it if possible. Now, I will say, if the HPV test is positive, you have to come back for the speculum exam to get that pap test or dual stain test to see if you need any further follow-up. So it's not a free pass to avoid a speculum exam for everybody, but about 80% of people, 80 to 90% of people will test negative. So most people can avoid a speculum exam with screening using self-collection.
How do you get the results? Just kind of however the normal way your doctor gives you results, like the portal or calling you.
Exactly. Yep.
I know that there's been a lot of studies done on this. Have people found it easy to do? Have they said it's anyone can do it?
It is very easy to do. It's been done in the context of research trials all over the United States, but also all over the world, in places with very low literacy rates, low education rates, on mission trips into the Amazon. And everybody can do it. So it is not hard to do.
So, what is the difference between the HPV test that you collect for yourself versus the one that your doctor collects, other than avoiding the speculum?
That's a great question. So the one you collect yourself has cells from the vagina. That is great for testing for HPV, but you can only test for HPV. If the test is collected by your doctor or healthcare provider, they're collecting cells from the cervix. So that has two advantages. One is we have more data, so we feel very comfortable that you are fine for 5 years if your healthcare provider collects the test, and if you collect it yourself, because the data we don't have as much data and some of them show slightly different results, we say you're good for 3 years. The second difference is because the healthcare provider has taken the test from the cervix itself. They look at the cervix and they take the cervical cells to test for HPV. If the HPV test is positive, the lab can then run the Pap test or other dual stain test off of that same sample. So you don't have to come back for a second test if your HPV test is positive, whereas you would if it was a self-collection, because you at that point would need to get the cervical cells to test.
Do you recommend self-collected testing? Are you very comfortable with them at this point?
The testing I recommend the most is any testing. If you have been happily screening along with your healthcare provider, doing a regular speculum exam, by all means, please continue to do this. If you, for any reason, are late, if you couldn't get an appointment with your doctor, if you skipped your follow-up test because the speculum was expensive, if you just didn't feel like doing that, please do a self-test. A self-test is great. And the idea is we can get more people screened because, again, half of cervical cancers occur in people who are late for their screening. So if you're screening, keep screening. If you haven't been screening, think about a self-test, because our goal is always to find people who have precancer so we can treat them and then people don't get cancer. And I mean, cervical cancer is the most preventable cancer because we know that if someone has a precancer and you don't treat them, about half of them will develop a terrible cancer over the next 10 years. And if you treat them, the risk is less than 1%. And the treatment is something we do in the office in 10 minutes. So it's just such an exciting place to be, because with vaccination and screening and treatment, the World Health Organization has talked about eliminating cervical cancer because it's such a preventable cancer. And vaccination is, more than 95% effective in preventing cancer. So, we can have a cancer-free generation just from vaccination. But there's also all this exciting work happening in the screening and management field to try to make it easier and more efficient and more effective for adults who were too old to get the vaccine when they were still kids.
Perfect answer. Thank you so much. Thank you so much for listening. If you'd like to learn more about cervical cancer prevention or self-collection, visit ashasexualhealth.org or the National Cervical Cancer Coalition at nccc-online.org. You can listen to all episodes of the Sex Plus Health podcast on Apple Podcasts, Spotify, or wherever you listen to podcasts.